My name is Brick Williams. I grew up in Cedar Hills, Utah. I was born in Provo, but lived in Cedar Hills most of my life. And moved around Utah County several places, and I'm back in Cedar Hills now. I've been teaching guitar full-time now for 24 years. I teach anywhere between 55 and 60 students a week. So it's a lot of driving and a lot of lessons. It's a full-time job. Being self-employed, that's why the healthcare marketplace was so beneficial for someone like me, being self-employed, being able to get affordable care. It's been however many years since the Affordable Care Act thing, and it's been nice to be able to survive better. And the things that are coming down the pipe, it looks like, are going to change everything back to a much uglier place for people like me that are self-employed. My life depends on these infusions. My chance at living a healthy, normal life and staying on the planet depend on these infusions. The cost of them is astronomical. For 2 doses of my medication, the bill that I get sent is $12,500. So, and that's every month, $12,500 roughly a month. So you're talking, what's that, $150,000 a year? So I have to have insurance because it's not like I have $12,500 a month. It's not what the bill included in it, it's what it didn't include for someone like me. With these subsidies ending, it's like, whoa, this is worrisome. The subsidies were a huge benefit for a middle-class family like mine. It's looking like, we don't know yet because the marketplace hasn't opened up, but early numbers are looking like I would have to pay more for health insurance in a month than I pay for my mortgage. And that's just for me to be insured, not my family, not my wife and my children, just me. Health insurance is going to cost more possibly than my mortgage. That's not survivable. Who can survive something like that financially? I can't imagine how much it's going to cost for me and my family to have insurance. That's going to be financially devastating. I mean, are we going to be able to stay in our house? Our house is just a moderate house. We don't live in a big mansion. We just live in a normal, small home was a dream we tried to buy a home for 19 years. 19 years. Do I need to change my whole career? I've been doing this for 24 years. Do I need to go work for work for corporate America just so I can have health care benefits that are affordable? Scrambling, trying to figure out what to do. I'd like to continue living the American dream and running my own business and being a self-made man, and that's looking scary though, so we'll see. There's a problem coming up right away the next few months with people being able to get affordable health care, and there's changes that are coming and things that are ending that are going to greatly impact lower class and middle class families. And these are devastating things. These are middle class incomes. It's not like people that are making grundles of money every year. It's just normal families trying to survive. So concerning. It's an ugly situation that's not being addressed. These are massive problems that people face, and I'm far, far, far from the only person facing these concerns. I mean, I'd like to believe if you live in the best country in the world, which, I think America in most ways is probably the best country in the world, but I'd like to believe that you can have affordable health care when you were born with a disease. I did nothing wrong. I was just born with a genetic disease that's plagued my life pretty badly. And to have that be the thing, and the fact that I'm self-employed, those two things be the thing that's going to be devastating to my family financially, that doesn't seem right. That aspect of it doesn't seem like the greatest country. Something's wrong with that part of it.